on this computer. Okay, there we are.
Call this meeting of the Parkview Health Center Committee to order at 3:30. Do we have anybody? Or I guess first we'll go to approval of the October 20th, 2022 minutes.
Thank you. Approval.
Second, Mr. Chairman. Motion and second. Any corrections?
Well, I didn't see any, but anybody else?
All right. All in favor, say aye. Aye. All opposed, say nay. Motion carries. Do we have anybody on Zoom for public comment?
No. We have one person on Zoom.
All right, just us. Then we'll go right on to number 4, the financial report.
All right, so for the financial report, my version. All right, so for October, it isn't quite closed yet, but we should be about 83% of our budgeted. See, our revenues are only at 72%, and that's due to lower census. But our total labor is also at 66% of budget, so quite a bit lower there. And the other categories pretty much are falling in the line. The utilities are a little bit higher, but we've had experienced some price increases there. Overall, running at 78%, so we're still looking under the 83 for that. So that's still looking pretty good. Even our contracted services are only at 68%, so that's good. Our total expenses 71%. Year-to-date actual is a negative $1,758,000. If we would have take the amount that was applied in the 2022 budget and used 10/12 of that, it would have been, we would be running a negative of $2,700,000. So we're about $950,000 better than what the budgeted number was at this point in time.
During what, third quarter?
Third quarter, yes.
Being in the third quarter, your contract services, including the snow and
mostly the contracted services are the professional services for. Could be a multiple of things, but the line 5514 is mostly our contracted RNs, LPNs. LPNs and CNAs, yep. That's a big chunk of that, yeah. Do have some other minor stuff that's in there, but that's the majority.
Any other questions about the financial report? All right, thanks very much, Doug. On to item number 5, the administrator's report. Would you like to walk us through that today?
Well, you can do the outbreak COVID status part.
Sure. We currently don't have any residents positive. We did have one, but she came off isolation on November 6th. So we currently do not have any positive residents. We did have a couple of positive staff, so they stay out on quarantine until their isolation is up.
Okay. So then, for the census for October, we had average census of 102, down from 109 from the previous month and 114 from the month before that. We had 2 hospital admissions and 3 hospital discharges, 1 home discharge, and 8 residents expired during the month of October.
I was, I looked at, is that average or high, low? Yeah.
The expired number,
Yeah.
it seemed like it was a little bit high, but so, and we still have 20 people on the waiting list. Private pay is averaging or about 20% of the population. Medical assistance, 74%. Family care, 4%. Medicare Advantage, 1%, and Medicare, 1%. So.
No, the waiting list was a little higher last month, wasn't it? Like 35, I thought.
So there is
Mhm.
35 total, but about 15 of them still haven't gotten our admissions coordinator their like most recent history and physicals. So officially 20 people that have turned in everything, but then there's about 15 of them that are still getting some paperwork into her, but they filled out applications.
Is there any way to monitor people who've been on the list for a long time and those who've been on there for
Yeah.
other stuff? Do you do that?
We have some family members that call every week or every couple of weeks just to see where we're at, but our waiting list really hasn't moved too much. We did just admit a hospital admission resident that is on the waiting list, but she wants to try to go home. So it's kind of fluctuates.
This question. Therapy area. I think people in the office, why not? Because I hear out on the street, I hear, no, they're not, yes, they are.
So we don't have a designated rehab wing anymore. Our rehab wing that we did have had a mixture of long-term care and rehab. Most of our rehab have discharged and we aren't refilling those beds because we only have 1 staff member down on that unit. So they can only handle a certain number of residents on that unit.
Yeah.
However, we've had some beds open up on other units that we've been able to take some rehab admissions
Okay.
because they either had a spouse there, they were comfortable going on a long-term unit. So it's kind of a case-by-case basis because we
Okay.
don't want to mix rehab and long-term care. If we can avoid that, it's not good for either population if you can try to avoid mixing the two.
I get that, but it's good to have rehab people in,
Yes, so
especially when the insurance is covered.
yes,
That's
we
when we
try to get,
go, because I know
Right.
somebody that was trying to come out here and they were told that we're not doing it, so they went somewhere else. And then the question was, what is happening to the rehab side?
it's
of it?
very case-by-case basis. If we can get them into an open bed where they would be appropriate, then we will. But if we know that they wouldn't be appropriate on that unit, we won't put them on that unit.
It's hard to be bedridden or a broken knee or
And it just depends on insurance, if insurance will give them off, different medications that they're on, if they're a 1 assist or a 2 assist, because some units can take only a 1 assist, some units could handle a 2 assist. It's based on a lot of different
So if
things.
you had an average Joe that just had a knee replacement, may have some medications, may not, but was able to fend for themselves before, they would have a greater possibility of getting in, correct?
Well, depending on their age too,
Okay.
so if it's a young person, we don't want to stick them on a
Right.
long
But I'm
term.
looking at, in
Yeah.
the 60 to 70 range.
Yeah,
Yeah, if they're a pretty straightforward rehab candidate where because a lot of people will say, oh yeah, my goal is to go home. Well, we look at them on paper and they weren't functioning very well at home to begin with. So we know realistically they're not going home and we don't have a bed for them to stay long term.
Okay,
So if it's a straightforward rehab and we have a bed where they would be appropriate for, then yes, we're trying to get them in.
How quickly can you go through data to give them an answer?
We have an admissions coordinator that reviews all of our referrals. She sends it out to the clinical team and the financial team, and then they
Couple
get
days?
back.
Couple days?
Usually
Day.
it's same day. Try to
Yeah,
be same
it
day.
could be the same day,
Well,
easily.
my experience is less than that. I mean, when I had to find someplace to go, I think it will help me kind of answer fairly quick.
Yeah, but you were pre-COVID,
Right.
so things have changed, but that's good to know, because this person that wanted to come out here said, well, they just said they weren't taking anybody. I said, did you ask the questions?
And sometimes we're not, like if the only beds we have open are on our unit with our COVID positive resident, which we had for a while, then we can't take any admissions because that unit's on quarantine.
If you have a large unit, you get one person COVID positive. Can you move that COVID positive to another unit which doesn't have a lot of people, or,
They either have to quarantine in their room if they're able to stay in the room. If they have dementia and can't stay in the room, then technically we have to move them over to a COVID unit. But trying to staff a whole unit for one person is also difficult. So we usually will call DQA and see what their recommendations are. But no, we can't move them to a different unit. They have to stay in their room or move to a COVID unit.
Yeah, then we have to staff that unit for the 3 different shifts.
right? Do you have emergency care here?
Emergency care.
Somebody turns up with a got a MRI or something like that. We gotta do a test. You got an emergency area where you can do that.
We would probably send them out to the hospital to that. We can do some mobile x-rays. We have a contract company that can come in and do some x-rays here, there at the building, but for an MRI or something like that, we'd probably just get an order to send them out to the ER.
Any staffing update, survey updates, or project updates?
Do you have anything on the staffing?
Staffing, we will be posting a new position for our therapeutic wellness supervisor that was in our budget. So I sent that form to HR today. So when that's posted, I know we have at least 2 candidates already internally that are interested in that position. So we'll be working to fill that position in the next couple of weeks here.
No. I don't know, I don't have anything for the nursing,
We're still very short staffed.
You said, yeah, what, I was just at the administration office. I thought I saw a posting for administrative assistant. Am I correct? On part-time and one full-time.
yeah, the administrative assistant part-time is our weekend receptionist.
Okay.
And we do have an opening there. It's usually the full weekend, once a month that they take care of. And we have the other weekends covered with other administrative aides.
Any
Yeah.
other questions?
I mean, you can cover maybe one project updates. What's
So
status of
the training center update is the contractor is working to finalize the last of the checklist that they've been going through. I know we went through it a week ago or so, and we wanted some additional shelving put in. So that's kind of on the list to get that done. We also have submitted all the documentation, so for the training, so if it gets certified as a training facility. So that's all submitted, ready for And I think that's all ready to go. We just have to have them come out and do an on-site visit once we can actually get in and everything is set up. The furniture, we still have to get the furniture that we need in there.
You have the furniture?
We don't have all of the furniture, some of it, yeah.
And then IS comes in and IT.
They're, well, I got the screen and the projector sitting in my office right now because they couldn't get into the building because the contractor has the key. And so that's ready to go for that. I think the computers are ready to go. We're looking for just tables like this. And we'll be ordering those probably this week, and chairs, and then we need 4 beds, working beds that are in there. So we'll be ordering 4 new ones.
Can you order them?
Yeah.
From this department, you don't have to go through purchasing, it's part of the bid.
Yeah, well, we would still go out for bid, but it's well, only if it's a big enough dollar amount for to be bid out. If it's, we can actually go out and buy the beds ourselves.
Good.
Our purchasing person can get that bid going, and that's should be going.
How many items do you have on that list?
Probably, well, it's 12 spots for tables, so 6 tables probably. And then chairs. It's list.
Worry about it every time it comes in the door.
Yeah.
Expedite or whoever.
Yeah. Yeah, and we're looking at getting some stuff possibly off of surplus, because I know there's a lot of schools that are getting rid of their tables and stuff that will work just perfectly in there, and they look pretty good. So that's pretty much that.
Thank you. Anything else? Any questions?
Oh, here.
All right.
So I should give you one, actually. Sorry, what I'm talking about. So this is kind of the whatever you get on here. And this is kind of the, if you're looking at the one that is labeled Parkview Health Center Financial Structure, this is kind of our fund. It starts off with the overview of the 530 fund. That's our enterprise fund. And each of the boxes below is one of our departments. So we code all of our invoices and wages and everything down to the department. If you look at the back part of it, so, well, we have an org, that's 530. The 53 in the front is designated the fund. The second part, the 540, would designate the department. Any objects with a starting number of 4 is just general revenues. If it has a 6, that means it's a interdepartment revenue. So, so if you look on the income statement, you see one labeled 6,000. $6,000 or 65,082. That would be the amount that we're charging out to for the crisis center for our food that we've sent to them. Any 5,000s are general expenditures. Any 7,000s would be interdepartmental expenditures. So if you look farther in, there's a let's say in the operating subtotal, there's a 53,580, 548. That's motor fuel. That's what we buy from, that's where we go over to the highway department and purchase fuel from them.
Interdepartmental type of thing.
Yeah. Yep. And then for the project, our only project that we have in our account string would be for a COVID cost. So masks and gowns and stuff get that separate coding so that we can track that separately. And that pretty much takes care of our financial structure.
So, where was the projects on the statement?
They don't show up on the statement. So they're all kind of, so if we have an expenditure, say, if we look in, medical supplies, 53,524, that rolls up everything that's in the nursing department, and that could be subcoded to a COVID grant.
What, 53?
524. Medical supplies. Yep. About third of the way down.
524, yeah.
Yeah.
534, service goods, 524,
524.
yeah. Medical.
Yeah. And then the general overall categories of revenue. If you look at your income statement, the first page, you got your intergovernmental revenues. That would be anything we receive from either the federal or state. Public service would be any donations or any private pay people. And
Hold on a second, all of these are like 45, 42, and 43.
yeah,
The object number.
Yeah.
But on the other hand, you're all 53s.
53s, yeah. So if you look at the top right on the top left, it'll say 530 Parkview on page 1. Actually, it says, yeah. And we can run this income statement for each of the departments or as the fund as a whole. And that's what I run for you guys.
What is the name of the software that you
This is Munis.
use?
Munis, yeah. Yep.
This was a county unit.
Yes, it is. Yep. Yep.
Transferred onto that.
Yep. And then,
Budget transfer on the back.
Yep.
To an object of 58002. Which is other.
that would be, that's our capital category. So in the revenue, let's go back to page 1, revenues, then you go when we have our miscellaneous revenue. So there's one in here, 48,102. That would be the state ITP transfer that we get from the state. It's not specific to a specific type of revenue or what it can be used for. So that's kind of a general grant revenue that we can use for everything. So that's why it's separated down there. Then you got your transfers. The 49,500 is the tax levy transfer that we get. Other transfers, that would be, so if you look at 117,000 there, 524, that's the amount that the general fund gave us for the additional dishwasher amount and the water heater replacement. 87,000 for the water heater and 30,000 for the dishwasher. That we're bidding out the dishwasher That will be due, the bids come back due on the 17th for that. We had a walkthrough meeting with some of the vendors on Tuesday.
You bought the dishwasher, but you
No, we haven't bought it yet.
haven't bought it?
No.
Yet we were over,
Well, we were over what they actually estimated originally back in late 2021, when they actually put the budget together. They went out and asked what the price was gonna be, and they said probably 100,000. Now they came back and we asked them again, you know, what's a pretty good price on this? And with the rising cost of everything, it went up to about 124,000. So,
124.9.
Yeah, and we gave our budget for the washing machine right now, or the dishwasher, is 130,000. So once we actually get the bids in and see what all the bids come in at, we'll know for sure if that's enough or not.
Bid on the hardware, or is the bid also for the labor that puts it in?
Well, the company that actually would bid on it, they bid the machine, putting it in place, and then the county electrician and plumber will connect it to our existing structure, or the electrical and the plumbing.
So there's additional labor after you get them in and have them set it down.
Well, the labor for the vendor is all included to get it, to remove the old machine and to put in the new machine in the footprint. Our facilities people will be hooking up, because we have a master plumber on at the facilities department and an electrician. So they can hook that stuff up for us.
So if it comes in 125,000, 5,000 less than you budgeted for, where does that 5,000 go? Does it go back to general fund compared to keep it to use it for something else? You tell me.
Only if we would bring in a resolution or budget transfer to allow us to use that for something else.
So
If it doesn't, it would,
How long does that linger? How long does
it wouldn't linger that long.
for that budget transfer?
It would be probably it would be done probably next year, depending on when our final bills come in.
Any other
Okay.
questions about the general overview of finance structure?
So I guess the only other comment I would make is then in the expenditure section, then you have a subtotal for each of the budget categories that we have. So total labor is a budget category, total travel is a budget category, total capital is another one, and then at the end, other operating is the final category that we budget on. That's where we look to see if we're over budget or not by category.
is that it? Yeah, what I asked her, this is very fine, but you know, when every month you go over, like I'm gonna repeat what you said earlier, though. Applied to fund balance $2.7 million, amount better than the budget applied, 949,000. That's kind of the, just to like.
Okay.
Kind of simplified, that's like. I said
So-
before.
If you look at the budget column,
Mhm.
that number is 3,293,000. That's how much. So if you would take out the depreciation amount and add in our capital line, that's what our budget shows. Because depreciation really isn't a cash effect. So that would come down to having an applied fund balance of $3,250,000. And in 2023, that's how much of the fund balance we applied. So through 10 months of the year, if you take 3,250,000 divided by 12, multiplied by 10, that's the 2,700,000. At this point in time, that's what we're saying. That's what our budget would be if we were right on budget for everything. And because we're at 1,758,000, we're actually doing better than what we had projected our fund balance usage was going to be.
So why do they want to sell the place?
It can't sustain itself at the moment. It cannot. So we hopefully pray, or whatever it does, that it starts going back up. Because at 100,
The hospital didn't tell us that none of the other facilities in Oshkosh were taking admissions right now either, so they're shipping people to Fond du Lac or Appleton, so. It's not just us, if that makes you feel better.
You know, take a look at the census for the state of sheriff, okay? It's a different animal altogether.
Oh, yeah.
But yeah, they sell room in their jail to other counties or other, to be honest. Allegheny County is very good at that,
Mhm.
selling room in their.
Oh, yeah.
Okay. You would wonder if you couldn't sell room here since you have housing separated.
Yeah. Then we have to worry about the staffing.
Well,
So that's kind of a double-edged sword.
yeah. That's just a thought.
Mhm.
Well, it sounds good, but you're asking for residents who live in whatever county, to move out of the county and come here. That's quite a, I don't know, I think I kind of believe, but jails is one thing, you know, prisoners gotta go whatever, find space for them, but, and that sounds good, but I guess I'm skeptical how many residents who need a place, who live in Green Bay or whatever, Two Rivers or whatever, and they'll say, oh, we'll come to Parkview and Oshkosh.
If they had specialty type things, they could deal with like match or something, they could deal with especially with, or with specialty, joint replacement or something else, that sort of, they had a specialist here that does that sort of thing, or is associated with, you know, with the institution. It would maybe help a general flow, at least getting the word out. I don't know.
I mean, if we had the staff, we could fill our 60 beds very easily. We'd probably get 10 to 15 referrals a day from hospitals.
right, I agree.
And we have our wait list, so the demand is out there. It's just we don't have the physical bodies of people to take care of them. If we had staff,
You don't want to contract because the dollars is too high.
right, we do
Yep.
have some contracted staff, but yes, you also have to balance. You don't want too many because then we're losing more. Right.
Right, should we move on? Yeah. All right. Do we want to do the tuition reimbursement program today, or is that something we should wait and have Lindsay do next time?
I would say wait unless you.
No.
I'm gonna make a comment. I don't say a comment. I respect Lindsay. I am Mary Beth request an amendment, and Lindsay told me that the county executive now thinks there's some college program, and I guess I'm skeptical. You know, we heard another department head, Bill Topol, say that that could be interesting in this department. And I'm gonna say this out, I am patient, but not extremely patient, because, you know, like we talked last month, we had to put money in the budget, we don't have that right now. How long are we gonna wait before we act? That's the question I have is, this committee and this board in general. Unfortunately, well, like I told Doug, like one person we have to convince is the county executive. I'm all ready to go for it. I think Lindsay has a program pretty well already set up. What are we waiting for? And anytime you want to bring this forward, to Lindsay or this committee, chairman, I'm all for it. But why do I fear we're going to be next year, middle of the year, and we're going to still waiting for it?
Hanging out to dry. I got you right there, I computed.
Yeah.
He said, the exec said, he wanted to hook up with workforce development. You remember that?
Yeah.
And I looked into that. There's no such thing. Now Lindsay telling me it's a program with the tech school or local college. I'm sorry. I think he wants to give us positive feedback, but he doesn't want to do anything about it. And I, for one, am willing to force his hand, but I can't do it by myself. So I respect Lindsay talking to me. That's why I didn't propose an amendment at the budget time. But Mr. Chairman, I don't want to be here next June saying to talk about this. Sorry.
Thank you. I think we'll keep this on for next time. We can just keep getting updates as to how this is transpiring.
And maybe next time, because today we can only discuss. We could put discuss and approve, and we could at least have a discussion with the option of approving it. If we so desired, or we don't approve it. But my feeling is, Parkview can handle this in-house if we pass this. They can do all it takes to do. We cannot make the Department of Workforce Development, which is not the place to go. So that's what I heard at budget time, was wait and we'll do that. So now we got some college program. Well, that's great, but do we or don't we? Or so I'd like it next month, and perhaps we can move ahead.
Yeah, I think we definitely need to start narrowing the options on this so it isn't an idea or a concept that's out there that gets too many legs in different places.
Isn't gonna work. Isn't gonna work for us from here. So, yeah, that'd be appreciated if we put it back on there.
Discussion and action, you said, or just discussion?
So that we have that option. We may not take action, but if we put it on the agenda, and we decide to take some action, we can take some action.
And I can talk to Lindsay about, as we get closer to see how those conversations are transpiring and if we're ready to have a resolution that we can approve. Because I think if we do have, there may be an intermediate step where this group wants to provide input about some of the different pathways that are out there. If that's something that we can bring forward in a way that we can approve something, I think we will.
Okay.
But if it's, but if it's still something where we maybe need to provide input about the administrative, preferences, the outcomes, I know you've talked a lot about the program design and implementation features. So, if we so I'll see where we're at and make sure we have the appropriate agenda item.
Okay. There are ways to get drilled down to get the plan of action. Each plan of action, whatever it is, whether it's Workforce Development Plus, or whether it's UWO Plus, or whether it's Ancillary Building Plus, or whatever, but get the actual plan of action, what is going to happen and what we have to do to get it to happen in each case. So we got something to draw from.
Yeah, I think that was probably a lot of what Lindsay was going to bring to us today. But I will make sure that we're as we're another month down the road in December, that we are starting to narrow the options and come to some kind of recommendation. All right, we'll go to item number 8, discussion and action of budget approval of $7,000 for small improvements to small equipment to purchase or for purchase of a floor scrubber.
Okay, so when we put in the neighborhood kitchen flooring, we had budgeted I think 79,000. something like that. We actually, when we bid it out, it actually came in at 69,000. And we have 7,000 left from that project that we'd like to switch over into small equipment. We had a scrubber that was in our lower floor that would clean the floors. The engine went out on that, and to redo that whole engine, it was $3,000. So we had contacted the facilities department. They use this, a similar model, and they were willing to just take what we had and part it out for repairing their scrubber. So right now we are not, we are down one floor scrubber in our lower facility, and then kind of does the great room and in the front entrance also. We can actually, and it's not something that is something that's used a lot, but we need something. Right now, every month or so, we are asking the jail to bring theirs over so that we can use it for a day to do our stuff, and then it goes back. And this way, if we would have one, and we can get a refurbished one for, I believe, less than this, so it'll work great for us. And that's what this one is about.
How old would you say the one? And maybe you don't know, but how old is the one that the engine went out on?
It was probably since we moved into the building, so.
I would tend to agree there.
Yeah.
Okay.
So, in the summer, it's a slower time for usage, but once people start tracking in salt and stuff, those work really good for.
How big is the scrubber you're talking about?
It's the-
Amazonian type?
It's not a ride-on one, it's just a walk behind, 32-inch one is what we're looking at.
I've already looked at it.
I've looked at a couple
Dollar
different,
amounts on it.
yep,
So,
and
it's only 70 or 7,000.
yeah, it's actually a little bit less than that,
With the
but
bid-
depending with the shipping and
The bid out that you had.
we didn't bid it or anything, we just,
No,
I
the
just,
bid out that you had for the improvement of flooring or whatever.
yeah,
For 79 and went to 69, that means you got.
or it was 76, I don't remember what the actual dollar amount. It was, we're actually sitting with actual $7,000 of extra right now. So we'd move that whole amount over into our small equipment.
I'll make a motion.
I'll second.
Motion second to transfer $7,000 from small improvement to small equipment. Any other discussion?
I just have one quick question, that we from the memory, does this have to go all the way to the county board or? can
No.
we pass it and-
And then it goes to the PNF, and once they approve it, then it's good. Because it's just a transfer. Yep, so it's coming.
So.
And
Okay.
Yeah.
So if this passes here and PNF, you could have a switching by.
at the end of the year.
Any other comments, questions? All right, all in favor of the budget transfer of $7,000 from small improvement to small equipment, say aye. All opposed, say nay. Motion carries. Item number 9, suggested topics. We'll carry over the tuition reimbursement program. Anything else that folks want to suggest?
I'm gonna put my 2 cents here, and I'm glad Maurice is here, because Chairman PNF, when I heard it, my spiel kind of at the budget meeting. Have we ever talked to the employees and see what would keep them here and help us recruit people other than pay and tuition response? And that's something I think the whole county should do. I think we should talk to our employees, and maybe they could either some people in the field, so I just bring it up for discussion, and I just say I'm glad Maurice is here, because I think the HR department should, so that's my spiel.
So maybe
To agree, but with serving your employees from time to time to find out just where they stand with you. You get a good feel for what their needs are. And what
I know they did a staff survey, the previous administrator. I don't think it went over the best, so I think if we did a staff survey, we'd have to very strategically do it. But I know things that have come up are things like childcare is always a barrier. And I know we've talked about that. I think other people have talked about that before.
If I understand though, like, what you're really looking for is like an overview of what are we doing right now on retention?
What we're doing and what's possible, what others are doing. I mean, I got when I talk to employees from the health department, they tell me, hey, this is what this county is doing. This is what this county is doing. And what my second thing, I'll maybe stop for a while. Is there any, it's a holiday season. Is there any way that there's a general get together that employees and us can somewhat get to know each other and mingle? Human Services has a thing every December. If it's never done in the past, maybe you don't want to do it, but I would like to have a frank discussion with employees. And I don't know the best facility, I don't have a kind of a social thing. Like I say, Human Services has their holiday thing in December. And really the customer appreciation event really wasn't a way to do it because there's so many employees. And I'm talking to about practical because that's what I like. So sorry.
I think you're gonna be hard pressed to have people talk about it. Because people are worried about talking, but they might do a survey. But again, if there's any way they think that survey can be traced back to them, they get a little leery.
Yeah, well, it's just the questions you ask on the survey have to be strategic because then you have to follow up and do something. And a lot of them are gonna say more staff. Well, we don't have a magic wand that can magically bring in more staff. If we did, we wouldn't be here. So that's the thing is you just have to be careful about what questions you ask because then you need to follow up and
if you had a suggestion, something where they can fill out a little suggestion or a little card, flip it in the box or whatever, and they get to do that, say, once a week. They can't go loading their box. And whatever. I started to throw these out to you because the surveys that were being done, all of these, and these are part of the survey that Tara did, okay, are all paid surveys to try to get everybody up to a level that they can, that you can have a retention based on the dollars that you're investing into the individuals.
And a lot of those surveys are, we send the Parkview is a member of other nursing home. It's a nursing home group, so they'll send just a question out. What are you doing for your retention, or what are you doing for incentives? That's just a question that comes from one of the members to all the rest of the member administrators, and they'll respond, and then that's what a lot of that's done. Yeah. So that's more just, it's not so much a paid survey, it's just a question to other administrators. What are you guys doing?
You can have an incentive to do a survey, and anybody that answers X number of questions in a certain direction maybe gets a free burger. But or you can have a general box somewhere that people can throw into, or you can have a general survey that you don't have to put the name on.
yeah, the last one was all anonymous. It was just,
Right.
it was kind of a flop from what I heard. It's before my time.
In the mail, I don't like to put my name on. But I like to answer them. Because people need to know what's going on.
I think it does make sense to try to, maybe it's, one of our next meetings, try to get an overview of what has been done and what is being done on the retention side. We've certainly seen a few resolutions that we've approved come through that are aimed towards retention. the discussion about the tuition reimbursement is, is also a piece of retention, and, and whatnot, but I think, if I'm hearing enough, or hearing it right, I think, it sounds like we just want to get a little bit of a baseline about what is being done, so we're not just sort of, throwing stuff out there, Sound right?
Pretty much, right? I mean,
But you mentioned about, why are you working at Parkview?
oh, plus, what do you hear from other counties that they offer that we should at least can look at? Maybe not do, absolutely do, but look at. And sometimes you get our best ideas from employees. And I mean, a few years ago, Doug, you've been here a number of years, when they changed the health care program, they had meetings with every department. Now, I'm sure that, do they do that every year? No, okay, but they did that. What's wrong with this county HR department saying, hey, let's meet with the Parkview employees here and or whatever, and get feedback from the retention, what's keeping them and what maybe could attract others. And I don't see any effort doing that. And that's more the big HR question, and that's why I'm glad Morris is there. But if we can do it Parkview, fine. I think so.
On the thin side of the HR.
Yeah.
But I do know, I know what you. Yeah.
But there's a lot of counties that don't have county. So keep that in mind.
I don't know, raise my hand or just step in. I think some of you know my background, and union, the union's gone, otherwise you would be able to ask them right out what helps out and what doesn't. I saw that most surveys, you have a huge amount of disgruntled employees, and you know what they're gonna put on that survey? 2 letters. You never get nothing accomplished. What we found out, and this was at Hoffmaster's, took an outside group, and then people didn't know them, no name, no nothing. What can we do to keep you? They didn't have a big turnover. Over there is, what can we do so you'll do your job? It's more like it.
Yeah.
I would think if you had an outsider, even one of us people, that they don't know, and we don't know their name, you might get a little bit of truth in it. And on that note, I was gonna ask this, when you give your report, I don't even know what it was on here. At any rate, I think it was an employee update or status or something. You know.
Staffing update.
COVID status?
No,
Or the
no.
Staffing update.
Exactly. I didn't hear, once I missed it, I didn't hear no numbers like we lost this many employees. I mean, you put on when you lost.
Lindsay has those numbers, and she was unexpectedly out today.
Oh, okay, because that's wondering, how bad is the turnover? You have 2, 3 quitting a month?
I think we asked for our turnover rate and HR was gonna try to figure that out for us.
And then what is the average age? Is childcare something that isn't not only getting childcare, it's expensive, but in a place like this, 2nd and 3rd shifts, you're in too many daycare.
Right, and that's
There's a lot of
what I've
options.
heard a
That's
lot
not
of our
even-
employees say. Childcare is a struggle.
But when you say turnovers too, there's retirements. So that,
Never mind retirement.
well, there's
Yeah.
not just retirement already. There's a lot of people that put in 30 years.
Yeah.
God bless their souls.
Yeah,
But-
that's a thing fast.
So we're losing an employee, but they retired, they have the right to retire.
Yeah.
So we don't seem to mention that in the mix of things.
And we do have a couple retirements coming up or that.
Mhm.
And
I see 1 or 2 at the board meetings here and there in
Yeah.
the Parkview area, but I don't even know how many employees you have here.
We have 224, I think it is. 225
24.
full-time, yeah. They're full-time
Turnover
equivalents.
would be interesting, which one?
It-
And why?
Yeah,
Right, that's what they call it, natural attrition.
yeah.
Yeah, because I didn't quit because of the pay.
Yeah.
They didn't get along. You just tell him he didn't wanna do anything, I mean, that's a lot.
Yeah.
Yep.
It's probably a little bit of everything.
All right.
But that'll be for next month, yeah.
We'll see what we get together, yeah. Item 10, our next meeting date, would fall on December 15th, 2022 at 3:30. Any conflicts, or does that work for folks?
Good.
All right.
Oh.
You're retired again.
All right, then, with that said, then item 11, adjournment.
So move, Mr. Chairman.
Second?
All right, all in favor of adjournment, say aye.
Aye.
We are adjourned.
All right.